86-year-old woman is rushed to the emergency department by her niece because the patient felt like she was spinning and about to topple over. This occurred about 4 hours ago, and although symptoms have improved, she still feels like she is being pulled to the right side. Her symptoms include blood pressure of 116 over 75, pulse 90, oxygen saturation 99% on room air. Physical examination reveals right-sided limb ataxia along with hypoalgesia and decreased temperature sensation on the right side of the face and the left side of the body. An urgent non-contrast CT scan of the head shows no evidence of hemorrhage. What other finding is most likely to be present in this patient? Options: hemiparesis, deviated tongue, hemianopia, intact cough reflex, and absent gag reflex. They have certain structures that runs in the lateral medulla, and that's why the patient has these symptoms over here, right? They can also have bulbar muscle weakness, and they also may have ipsilateral Horner syndrome because your tract from hypothalamus going down to your thoracic spinal cord is going to be involved. It also runs in the lateral medulla, and that's why it can also cause ipsilateral Horner syndrome. Now, can somebody tell me what artery is kind of obstructed in this patient? What artery supplies lateral medulla? By the way, lateral medullary syndrome is also called Wallenberg syndrome. Okay. You can also give me an abbreviation of the artery. Have you heard of PICA? Posterior inferior cerebellar artery. That's what supplies lateral. Okay, so now what are the certain structures and what symptoms would you see? If your inferior cerebellar peduncle, which is connected through the medulla, that is included in your lateral medulla, and that's why patients will have ipsilateral ataxia. Like in this patient, they have right-sided limb ataxia. Your spinal nucleus and your trigeminal tract is going to be involved, and that's why patients will have ipsilateral loss of pain and temperature on the face. Okay. Your solitary nucleus and your nucleus ambiguous, both of them, they carry 9 and 10 fibers. Solitary is mainly sensory, nucleus ambiguous is mainly motor. And that is why patients are going to have absent gag and cough reflex. Gag includes both 9 and 10, right? Whereas cough reflex is only vagus. Now, D option, they say intact cough reflex. It cannot be intact if the nucleus has been affected, right? So D is already out. The answer is absent gag reflex. Why? Because your solitary and your nucleus ambiguous is affected. Also, lateral spinothalamic tract. Spinothalamic, if you remember, it carries pain and temperature from your contralateral body, and that's why these patients will have contralateral loss of. So we ruled out D. Let's see C, hemianopia. Hemianopia or hemianopsia is kind of the same thing. You will not be able to see half of your visual field. It can be homonymous versus heteronymous if you remember your optic pathway, right? Depending on the area that is involved, depending on the brainstem area as well and your optic pathway, you will be able to understand homonymous versus heteronymous hemianopsia. Okay, but that is not seen in lateral medullary syndrome. Deviated tongue, that tongue is going to be hypoglossal, right? That is cranial nerve 12. And hypoglossal nucleus is towards the medial side of the medulla. And if you have medial medullary syndrome, then that is going to be affected. Next is hemiparesis. Now, hemiparesis is mainly, we call a motor, right? Kind of paralysis, motor paralysis, and that is corticospinal tract. Corticospinal tract, as I mentioned before, that is going to be pyramids. Pyramids are in the medial medulla, not the lateral. So again, that is not going to be involved, and that's why the answer is E, which is absent gag reflex.
Thanks for watching. Please give a thumbs up and subscribe for more.